right, let's start real quickly. Palm Beach County opened up phase one about 72 hours ago. Just to our north, the Treasure Coast has been open for about a week and a half now. From your standpoint, how would you rate the reopenings in our area here in South Florida? How are they going?
I would say that the reopening of our economy has been going very smoothly. We knew it was going to be quite the undertaking to go from where we were previously to start to get back to the swing of things. Restaurants open at limited capacity, other retail open at limited capacity. And we also understand that Floridians are going to need to cooperate, and we thank them and appreciate them for taking those difficult decisions and taking those precautions that they continue to do so. We've been looking very closely at the data. We've been looking very closely at the rate of positive results that get returned on a daily basis. We've been looking at emergency room visits associated with symptoms like shortness of breath, fever, and cough, things that we know are associated with COVID-19. And all of the data, all the trends, they look good for right now. Everything's been going in a downward trajectory, and we hope to continue as we, again, start to open up in phase one, and in some cases, looking forward to phase two.
For Palm Beach County specifically, can you discuss the challenges that we face, much different from the other counties that have opened up? We're in that 60% cluster here, and I know we were delayed by a week opening. What challenges and fears do you all have opening up Palm Beach County as opposed to other counties?
Well, certainly the amount of cases that we've seen in the Tri-County area, Dade, Broward, and Palm Beach. Palm Beach, we obviously are concerned with the demographics. So it seems like Palm Beach's COVID-19 patients seem to be a little bit older. We know that the older you are, the more challenges we have, both in terms of severity of symptoms, hospitalizations, and unfortunately deaths. So that's something we're keeping a close eye on. Overall, they've been doing well. Palm Beach was below that 10% rate of positive cases. So that's something that I think that we'll continue to monitor. But again, the other part of it is the confidence that the individual is going to have in their state government decision, in their county decisions, and in how the unveiling and the reopening is going about. So I think the more we can ensure that we're doing things the right way, the more people will have confidence and will start to once again venture out when it's safe and in an appropriate manner.
And picking up right where you left off, you mentioned phase two. What will phase two look like? And when can we see that here in Palm Beach County? Are we talking days, or in fact in South Florida, in days, weeks? What's the timetable?
Well, I don't know that we have a specific timetable, but obviously the rest of the state opened up a little over a week and a few days ago. Palm Beach just this Monday, Miami-Dade and Broward still not there. The hope is they'll be there next week. But as we look at phase two, that's going to come, I suspect, with an increase in capacity for certain restaurants and other retail. It'll be gradual, again, taking into account that we have to look at the data, that we have to look at the numbers as they continue to report them. And then also we've been hearing a lot of clamoring around the gyms. People want to go back to the gyms, get fit and do all their exercises. I know the parks and all of that is open. But I think, again, we're trying to do things gradually, make sure that Floridians have confidence in the decisions that we're making and that they feel that their government is taking into account both the public health needs as well as the economic needs.
Do you think there's a high probability gyms would open up in phase two, or would it be later?
I would think so under certain conditions. Again, I think that there's been all sorts of discussions had about if you do it by appointment only, make sure the machines are, distance enough from each other for that 6 feet social distancing, continued sanitation protocol. So I think that will likely be on the table. I don't know what the governor will ultimately decide.
I want to talk about beaches. A lot of the beaches, it's up to mostly the individual counties themselves to structure this and to reopen. We've seen some issues come up. Naples had to close their beach down. There's more intel coming in that some of these beaches, the social distancing is not working and the crowd control is a problem. How are you all monitoring this at your level to know that we're getting this right here by opening the beaches, but it's ultimately up to the individual? How do you monitor that and engage this to open it up?
Well, I think you've heard Governor DeSantis really talk of late about, the decisions that we're making, wanting to make sure that we don't overreach, that government sometimes, and we've seen many examples in the West Coast of just, what he refers to as petty tyranny. But I think when you look at the beaches, when you look at the data, everyone from the Department on Health on down, they seem to think that, public spaces, open air spaces, your risk of exposure is reduced. Of course we want people to take the precautions. Of course we don't want to see, throngs of crowds, converging on our beaches in a way that doesn't make sense. But I think, again, local governments, the governor contemplated them being able to do things that make sense for them. But he also doesn't want for it to be too much of an overreach. I think, again, we have to do things smart. We have to do them in a safe manner and really take into account the science, which shows that, again, in the open air, it seems like the risk of exposure and the virus spreading is much more reduced than if you go, for example, to your local grocery store.
We had a relatively small poll on Facebook 2 days ago, 1,200 people. We asked them how they felt about Palm Beach County reopening, and overwhelmingly, more people felt cautious about it reopening and felt like it was too soon. As you hear that from one side of the public, and then you hear the business owners who are frustrated, who can't wait to flip that sign from closed to open up, they're just clamoring for any sign of life. How do you measure that to know you're getting it right with regard to the mental, people just feeling safe, and those who it's part of their livelihood, they need this to open up? How do you measure that and gauge it?
Well, I would tell you, I would equate that to walking on a tightrope with no ability to balance yourself, because it is very difficult. We understand there are people that feel like government is moving too slowly, and there are people on the flip side that feel like government is moving too quickly. And what I will say is that we try to make these decisions based on the best and the best available data that we have, and also the best interests on behalf of Floridians. We recognize that this virus isn't going anywhere anytime soon. The prospects of a vaccine in the near future is probably not going to happen. We know that they're working diligently to try to acquire a vaccine and the antivirals that we've seen, but we're going to have to learn to live with this virus for the next few months, and so it's just not feasible to keep the economy shuttered in perpetuity. We want to do it safely, and we want to take into account, again, what are the measures we can take? Everyone has a role to play. We hope that everyone does the appropriate thing and make sure they take the precautions necessary.
We spoke a couple weeks ago. One of my questions was about the state's Connect system. I know a lot of things have happened since then positively to get more people their benefits. Can you elaborate more on the system to date and where you see it, and the help for people who are still struggling with that system and where they can go?
Sure, that's been an important topic, and we spoke previously, and I know I've spoken quite a bit on this topic. The Connect system, quite frankly, just doesn't work. So we've done everything we can to patch it, to put Band-Aids on it, to prop it up as best as we can. We want to make sure that Floridians get paid quickly and efficiently. We are making progress indeed, but I recognize that there's still Floridians out there listening right now and saying, well, I haven't gotten my check yet. And so the governor's mandate has been simple: get everyone their check as quickly as possible, get through all of the difficult challenges that we have with the system. Don't let that be an impediment. We've sent over $1.7 billion, and that's B, capital B, $1.7 billion to Floridians. And so I know that there's still individuals waiting, but we feel like each day we're able to really make some progress, really get Floridians those checks that they desperately need. And so that's a commitment that the governor has had since day one, and we're going to continue to work fast and furiously to get them their money.
And finally, just what's the trajectory right now as we stand this week? I know data changes day to day, and as you look and process how to reopen parts of the state and our area, what's the focus right now from your office and from your level on where we stand today and tomorrow and looking ahead? Is it just phase 2? That's what we're looking at right now? Is that the focus?
Not necessarily. Obviously, phase 2 and potentially phase 1 for those 2 remaining counties. How is that going to roll out? But also, we continue to look at the things that the governor has dedicated as pillars. And again, hospitalization, making sure that there's never an issue with capacity, our nursing home residents and assisted living facility. We're spending a lot of time on that. testing. You saw the governor unveil the mobile lab with the rapid testing. So we're sending that and deploying that to long-term care facilities throughout the state. We want to make sure that there are a significant amount of Floridians that are still going to be vulnerable. And so we're going to have to continue to protect those individuals, make sure that the state is doing everything they can to provide them with the resources they'll need. Again, testing, rapid testing, ideally in those cases to test the staff, because that's the only way that virus gets into long-term care facilities. There's no visitors, and those individuals have been there, so the staff obviously is the key to containing the virus. So a lot of those things are continued areas of focus, but there are so many moving parts to this pandemic that I will tell you every day we have to sort of approach it and attack it in a different manner.
All right, Lieutenant Governor, thanks so much for your time today. Good luck with everything, and can't tell you how much we appreciate you talking to us. Thank you.
Pleasure. Bye-bye.
Take care. Bye-bye.